Thank you. It is estimated that over 60,000 people in Connecticut have epilepsy. Hartford Healthcare's Ayer Neuroscience Institute is one of the only places in the state with an advanced technology to improve treatment of seizures. Here to tell us about it is Dr. Gabriel Martz, Director of the Comprehensive Epilepsy Center at the Ayer Neuroscience Institute. Doctor, thanks for being here this afternoon.
My pleasure. Thank you.
Let's begin with some of the basics. Why do people have seizures?
Well, normal activities like talking and walking happen because the parts of the brain talk to each other using electrical circuits. And seizures basically hijack and make short circuits out of those normal circuits. And that can happen for any number of reasons, any injury to the brain, any major disturbance, so low blood calcium, to alcohol withdrawal, a bleed in the brain that causes a disruption. Anything like that can cause seizures.
Are there different kinds of seizures?
Oh, there's as many kinds of seizures as there are parts of the brain, essentially. So lots of kinds and there's so many reasons to have seizures. But the trick is that not all seizures cause you to have an obvious manifestation in your body. Not all seizures cause jerking. Sometimes you might just be staring or not able to respond normally. And so the reason that we like LTM or long-term EEG is that by watching the brain waves, we can see when someone's having a seizure, even if it isn't obvious standing in front of them. So someone who has like a bleed in the brain, for example, may not make an obvious seizure, but if we're watching them on brainwaves, we can tell that in addition to that injury, they're also having seizures. That really changes the treatment we can offer them.
Yeah, I bet. What about brain damage? Do seizures likely cause brain damage?
Well, a short-term seizure, not necessarily, but if a seizure lasts a very long time, like 5 minutes, 10 minutes, an hour, a week, even weeks long, that certainly can. And if you have an injury to the brain, like I said, a bleed or a brain tumor, an infection of the brain, that part of the brain's already hurt. So if it has, in addition, the extra work of having a seizure, which is a lot of work for that part of those brain cells, that can definitely cause brain damage. That's a medical emergency for sure.
Dr. Martz, you were just talking about long-term monitoring with EEG. How does that help? Can you explain a little bit more about that?
Yeah, we're very excited because we're now offering long-term monitoring as part of Hartford Healthcare at St. Vincent's Medical Center as well. So what long-term EEG really does, it's continuous EEG recording of the brain waves. We're watching those brain waves continuously. We have trained personnel who are watching them live time, and we have video as well. So what that means is that when someone who's at risk for seizure actually has a seizure, we can react very quickly and treat that seizure. Also importantly, people who are at risk for seizure but aren't having seizures, we can avoid treating them with unnecessary medicine. Someone who, for example, has a bad infection and might be shivering because they have fevers, well, if they're in a coma, we can't ask them. We don't know what they're really thinking. We can look at their brain waves and say, that's not a seizure. Let's not further sedate them.
And really quick, doctor, do you know how many hospitals in Connecticut have LTM?
As far as I'm aware, it's Hartford Healthcare, so Hartford Hospital offers it, CCMC, Connecticut Children's, Yale New Haven offers it, and now St. Vincent's.
Wonderful. Thank you so much for your time, doctor. We appreciate it.
Yeah, my pleasure. Thank you.